Good morning, good afternoon, and good evening. Myself, Dr. Ekta, and I come from Department of Anesthesia, CMC, Vellore, India. At the outset, I would like to thank the GWEC team for inviting me here and allowing me to talk on the topic challenges and solution for wellness of healthcare workers in LMIC and LIC. It's my experience from India. I bring you all greetings from India. My disclaimers, I have used AI for beautifying my slides. I have got data from Health Ministry of India website. My few articles are from Update of in Anesthesia, WFSA articles, but I took them because they actually explained the reasons which are common to India. I'm not going to talk about what is wellness. This is the conference where you've been learning about wellness day in and day out. What I am going to focus today is the challenges. So I will talk about challenges which we face in India. We have system-based challenges, we have social structure-based challenges, we have individual-based challenges. Now, if you talk about system-based challenges, healthcare worker to population ratio is unhealthy. There's more of resources in rural, urban area, so urban to rural equity is missing. The financial crisis in terms of GDP, how many percent of GDP going to healthcare is less for India, which is a big problem, and it does not give assurance to the healthcare workers that they'll be looked after once the job is over or once they are retired. A very unique problem which occurs in India, I am not sure whether it exists any other country, in any other country, is that patients consider doctors as gods. Earlier, it used to be literally God in the sense that there was a lot of respect. It was satisfying at least, but now with the changing trends, it is more like a convenient way of considering them as God. And what the expectation is, they should be present 24 hours. They should be compassionate. They should show empathy. They should be good in clinical skills. They should be 24 hours around, and they should be smiling. And they should not ask for money. They should not ask for work-life balance. But slowly, the concept of work life balance is coming. We are taking small steps, but it's happening. Now, coming to individual based challenges, the healthcare workers have their own health challenges, their coping mechanism. Then also sometimes people take the profession just based on the reputation of jobs and not really passion based. So that's where problems come. Everything becomes stressful, and also time has come that we should be training the undergrads and postgrads about uh, wellness, about non-technical skills, and about leadership. So in India, definitely our system is under hypoxia. There is a demand supply mismatch. Time has come to look for root cause analysis should be done, and the strategic blueprint for the structural reform and workforce resilience should be done. This is a beautiful graph which shows, how it works when you have optimal system, imbalance, and critical. I would say India is somewhere in imbalance zone where there's some compensatory mechanism are always on. The staffs are working longer hours. They are working at different sites. Their supervisions are far off. So there's a lot of stress. There's a possibility of stress. And whenever situations like COVID pandemic came, the systems tip towards critical where anaerobic metabolism starts to happen, burnout sets in very easily. Other reason for our burnout is obviously the standards are 44.5 healthcare workers among for 10,000 population, whereas in India it's only 21. So our system definitely is suffocating. Now, that's not the only thing about this number. The patient population is changing, they are aging, the complexity is increasing. We have communicable disease still on board, but because of the changing lifestyles, we have moved and there's rising non-communicable disease. So what happens really is patient desire empathy, accessibility, and continuity of care, but they often encounter fragmented, brief, and overly clinical interactions. And this is not a dissatisfaction only for patient. This leads to burnout and dissatisfaction among the healthcare providers, and they undergo exhaustion. So this is to highlight the fact that we're having absolute shortage of healthcare workers, as per WHO norms. Whenever there's shortage, the existing staff has to overwork, there's burnout, and then because of burnout, the masses exist. This leads to further shortage. So this, along with the distribution disparity, leads to unhappiness, and because of this unhappiness, the brain drain happens, which is a bad thing for any country. Now, as I talked about urban and rural disparities, rural healthcare workers bear the heaviest burn of systemic hypoxia, facing profound isolation and lack of essential support. So they need to be really taken care of. I will talk about this state, which is the Kerala, where this is one of the most developed, states of India. They talked about good staff, experienced staff. They talk about availability of hygiene and cleanliness. They did mention that there's shortage of modernized equipment, shortage of grievance mechanism, and access to the location. But there's no talk about empathy. Empathy should be an operational matrix. We are very far from it. But remember, empathy burnout nexus also exists, where administrative overload is there. You are supposed to work more. You are chronically understaffed, so a lot of pressure of work pressure. At the same time, unprocessed moral injuries do happen. So empathy is an operational casualty of systemic hypoxia. Depersonalization is the mind's defense mechanism against structural exhaustion. Healthcare leaders cannot mandate better bedside mannerism without structurally repairing the working conditions. So, the false dichotomy of individual resilience, while we are taking many steps to help individuals, remember they will merely be the band-aids on the massively bleeding wound. So you need to not only work on individuals but structural deficiency. So let's look into the solutions. Now, solutions can be long-term, short-term, individual-based, and system-based. So for a country, they should focus on systemic and long-term improvements. Our country is working a lot on improving infrastructures, like creating medical colleges, creating nursing colleges, increasing number of seats, identifying correct people to do correct job. Rural equitability is on board. So there are a lot of work going on, but institutions can do a lot of work. They can actually focus on individuals' long-term culture. They also should focus on no blame culture, or contracting locum rather than exhausting existing providers. And departments can focus on short term and individual focus. So the short term focuses really try to reduce the demand. Like there's a lot of writing work, documentational work is there that can be looked after by technology. You can have command center supervision. You can try to create task shifting. Remember to train these people, otherwise they'll go under a lot of stress. But the countries aside should really look into the bigger system, the ecosystem, which really give you a long-term benefit. Time for many countries have come to redefine the metrics of success, more so in terms of functional based evaluation than input based. Our country is still based on input based evaluation, and I hope very soon we'll talk about function based evaluation. So, take home message: pragmatic solutions. There is no shortcut. Small steps will take you far. Remember to look for the root cause and then work on your system. With this, I hand over to the team. Thank you.